Hey, it's Dr. Frisella. I just wanted to make a short video updating the community on where orthopedic practices are with COVID-19, where things stand today, how we can treat orthopedic injuries. So just briefly, since I last did one of these videos, COVID-19 has become a lot more prevalent. There are a lot more cases in the United States and specifically in Missouri and the St. Louis area. In fact, Missouri went from being one of the fifth lowest state in terms of number of cases to the 20th. So it really increased the number of cases. I think we're going to see a lot more cases in the St. Louis area over the next week or so, and I think we're going to see a lot more cases in Missouri as a whole. In Missouri, St. Louis County, and St. Charles County are among the top 5 places with COVID-19 cases. St. Louis County, St. Louis City are, I think, number 1 and 2. St. Charles, I think, is number 5 after Kansas City and maybe one other place. But in any case, we're seeing it across the state. Now, when we think about treating orthopedic injuries in this situation, where are we? Number one, ERs still open. If you have a serious injury, you can still go to the ER. Urgent care is still open, seeing anyone. They're going to be screening patients for respiratory symptoms or a fever. But certainly, urgent cares are still open and available. Now, when you have a patient that needs to be seen for an orthopedic injury, orthopedic practices are still seeing patients. Our practice is still seeing patients. You can make a new patient appointment just like you used to. Now, we're going to be wearing masks. We're going to be screening patients. We're going to be wearing gloves. And we're going to be doing things to minimize the chance that we get infected or we infect one of our patients. But it is business as usual. We can see new patients. Now, there are some restrictions now in terms of getting MRIs. So next step in maybe taking care of the orthopedic injury is the injury occurs, you're seen in urgent care, you maybe do some therapy, now you're in an orthopedic practice and maybe we order an MRI. The major radiology practices are starting to limit non-urgent, non-emergent MRIs. Now, if you have someone that comes in, they've injured their shoulder, they can't lift their arm, well, that patient's probably still going to be able to get an MRI. However, a patient who had long-standing problems, the injury occurred a year ago, it's a litigated case where things have been dragging on for a long time, it is possible that you're going to see delays or problems in getting MRIs for that patient. CDI, for instance, is closing some of their locations. They're asking that we only do urgent and emergent MRIs. Other radiology practices are the same. So although if it's really necessary to identify an acute traumatic injury, we can consider it urgent and you will be able to get an MRI. You may see some delays or some situations where we defer getting an MRI to try to put it off to the other side of when the peak of all these viral illnesses happens. Now, in terms of physical therapy, another mainstay of treatment for orthopedic injuries, physical therapy is still available. Most therapy offices are doing in-person visits, but they're also converting to doing some telehealth visits, and I'll talk about telehealth as well. Telehealth being visits that are done via video conferencing. Great idea. You can still get therapy. It's still being done. Some of it might be being done through telehealth. Finally, surgery. Surgery is becoming limited. Surgery centers nationally and locally are asking that we limit our surgeries to urgent surgeries where if they're not done now, there's going to be a change in the outcome. Now, for some orthopedic injuries, even many, surgery is still appropriate to do now instead of waiting, but we're trying to balance that doing it now with the risk we might be putting people at by exposing them to the healthcare environment, other people, and to do our part to help contain the spread of COVID. So in a case where it's clearly not an urgent surgery, you may see a delay in proceeding with surgery. Now, I think that's going to be a minority. It's not something I've seen yet, but it may be something that you do see. So as of today, March 30th, that is the current state of affairs with treating orthopedic injuries in the setting of this COVID-19 pandemic. Thanks.